Hello. Thank you for giving me the opportunity to present to you today. My name is Hilda Benitez, charge nurse for Family Centered Care Unit at Kaiser Panorama City. I am also finishing my master's in nursing with emphasis in leadership. I am here today to present to you a strategic goal, a plan on how to improve the hospital consumer assessment of healthcare providers and system star rating of the perinatal unit at Kaiser Panorama City in terms of patient satisfaction with nurses, communication, and how patients rate nurses in listening and explaining things in terms patients understand. Why is this important? HCAHPS is the first national standardized publicly reported survey of how patients perceive hospital care. Research shows that a good communication between nurses and patients is essential for the successful outcome of individualized nursing care of each patient. At Kaiser, nurses are empowered to use the nursing professional practice model to standardize their care and move their practice forward. So it's a wonder why, with such powerful model, HCAHPS score is not perfect. A thorough SWOT analysis was conducted to identify what are the weaknesses that we can improve on. Some of the weaknesses identified are due to short staffing and a high patient turnover, which are causing nurses to be more task-oriented, also overwhelmed, and nurses feel like the patients are not getting the quality time they deserve. Some threats identified due to this is that new nurses or contractual nurses are being hired, but they are not familiar with the Nurse Practice Act or professional practice model that Kaiser use. Despite these weaknesses and threats, the Kaiser nurses still feel that they have a good camaraderie and teamwork in the unit, which strengthens them as well as increases their job causes them to have a high job satisfaction rate. Also, it has been identified that there are a lot of opportunities to improve the nurse communication in terms by using communication tools that are available to nurses, such as the Nurse Knowledge Exchange Plus or NKE Plus that is utilized when nurses do their handoffs. There are qualified bilingual staffs on site, and a video remote interpreter are available for patients who speak a language other than English. Also, Get Well Network is available to every patient in every room. This is a television network where patients can see educational videos as well as medications and so on. The strategic goal identified is to increase HCAHPS ratings on nurses' communication on how patients rate nurses in listening and explaining things in terms patients understand. From a 3-star rating to a minimum of 4 stars as measured in January 2018 to December 2018. To guide us, a strategic map was used to ensure that the business processes were in line with the organization's mission. And this mission is to provide high quality, excellent care to our members at an affordable cost. The learning and growth goals would include improvements of nursing communication by means of annual training, competency check, and team building seminars. The unit-based team committee will be utilized as a playground on how to use or how to improve nurse communication in the unit. Also, nurses who speak language other than English are empowered to become qualified bilingual staffs. This will help increase efficiency and patient satisfaction in the units. Improvement in nurse communication will support the internal business process and foster a synergistic and respectful environment among all stakeholders. Nursing practice will be enhanced by the innovation and evidence-based practice and recruitment of a culturally diversified nursing staff will also lead to achieve these goals. Customer service will be affected by these changes, and we can expect nurses to utilize the available communication tools to increase trust, build that trust between nurse, patient, and a relationship. Also, excellent nursing care will be rendered and strengthened because nurses are backed up by the evidence-based practice. Patients and families have a better understanding of their care because proper language interpreter services are available. Consequently, financial performance will reflect a positive margin because membership will grow. Also, this will minimize any litigations or lawsuits due to outdated nursing practice, miscommunication, and negligence. So, with everyone's approval and support, we can collaborate with the maternal child health director, charge nurses, managers, to launch a campaign to improve nurse communication on listening and explaining things in terms patients and their family can understand. The manager can introduce the campaign to the staff in the next staff meeting. Charge nurses can huddle, take a moment, have a mindful moment, and reflect on redefine nursing. Why did we become nurses? It's for the patient. So this hopefully will give time out of such an overwhelming workplace. Within the next 3 months of time frame, nurses are expected to have completed a skills training, be validated on the use of communication tools such as the NKE Plus, GetWell Network, and the video remote interpreter. A nurse communication champion will be identified who will help or be the support of the staffs in every shift. Also, charge nurses will round on every patient each shift to ask patients and their family if anything needs to be clarified to do service recovery. Within the year, ongoing monthly meetings will be attended at the unit-based community so we can discuss, analyze, and report the HCAHPS scores, as well as monitor the trends and be able to provide rewards and recognition to the nurses who are involved in this success, as well as make changes if there's a decline in the scores. To communicate the process of the plan, formal and informal communication will occur using various forms of written and visual communication. If given the opportunity, I will send an email of the proposal of the campaign and also include validation tools to ensure the success and compliance of the nurses. I will also meet with the upper leadership to provide updated data of the HCAHPS scores in your quarterly meetings. I will also meet regularly with the unit-based team for monitoring of the progress. Each shift, charge nurses will be asked to huddle, to reinforce, and also remind nurses to utilize the communication tools. Communication campaign posters will also be placed in each unit to achieve information retention and serve as a visual communication tool. All through the year, an open discussion will be conducted among all the staffs to serve as an informal communication and allow feedback and apply changes if necessary. To evaluate the success of the strategic plan, we will use the feedback control method. The HCAP score on the patient satisfaction survey on communication from previous year, as provided by the director, will serve as a guideline and to compare any improvement with a month-to-month basis. Also, inpatients are surveyed daily if nurses are explaining things in terms they understand. Based on their responses, the managers are alerted, and then the charge nurses do real-time recovery so that prior to discharge, the patients are ensured that they are understanding their plan of care. Also, every member, whether outpatient or inpatient, are provided a survey in the mail, and these scores are tallied and also put in a rating scale. The results of this survey will reflect how nurses are improving in their communications. Improving nurse communication scores is a significant part of Kaiser's mission in delivering excellent care to every patient at every time. The nursing profession exists because there are people who need us to advocate for them and at the same time act as their health educators. But if patients do not understand us or we do not listen to their needs, then we fail as nurses. Studies have shown good communication improves care that is provided to the patient. The best expertise, training, and continuing education of nurses in matters relating to the proper technique of communication will enable them to respond adequately and humanely to the expectations of patients. In conclusion, I ask for your support in providing resources in this campaign to improve nursing communication. With your help and collaboration, we can achieve greater results. Nurses' morale will be boosted because if they know that leadership gives value to their profession, then they know that they do make a difference in other people's lives. Thank you so much for your time and consideration. Feel free to ask me if you have any questions. Have a good day.